A craniectomy is a surgery done to remove a part of your skull in order to relieve pressure in that area when your brain swells. A craniectomy is usually performed after a traumatic brain injury. Craniectomy versus craniotomy. Craniectomy, surgical removal of a portion of the skull. Craniotomy, a special saw with a footplate that allows cutting of the skull without cutting the dura mater. Craniotomy, surgical opening of a portion of the skull to gain access to the intracranial structures and replacement of the bone flap. Craniectomy, with excision of tumor or other bone lesion of skull. Craniectomy, for osteomyelitis. The physician removes a portion of the skull bone invaded by tumor or infection. The physician incises and retracts the scalp and removes bone from the affected area. A bone graft or plastic replacement may be used to reconstruct the skull. The scalp is anastomosed and sutured in layers. Craniectomy, subtemporal, for section, compression, or decompression of sensory root of Gassarian ganglion. The Gassarian ganglion is located and decompressed or stimulated. If indicated, the nerve or a nerve branch is sectioned. The bone flap is replaced and fastened. The scalp is reanastomosed and sutured in layers. Craniectomy, suboccipital, for exploration or decompression of cranial nerves. The physician performs a suboccipital craniectomy to explore or release pressure from the cranial nerves or tracts in the brain stem. The physician explores and frees affected cranial nerves from the surrounding tissue. Craniectomy, suboccipital, for section of one or more cranial nerves. The physician incises and retracts the scalp and removes bone from the occiput. The brain is retracted to reveal the brain stem. The affected nerve tract is explored, decompressed, or resected. The bone is replaced and stabilized. The scalp is anastomosed and sutured in layers. Craniectomy, infratentorial or posterior fossa, for excision of brain abscess. For excision or fenestration of cyst. The physician incises and retracts the scalp and removes bone over the area of the abscess or cyst. The abscess or cyst is identified and excised. The bone is replaced and stabilized. The scalp is anastomosed and sutured in layers. Fenestration is the surgical creation of an opening or window in the cyst to allow it to drain. Craniectomy for excision of brain tumor, infratentorial or posterior fossa, except meningioma, cerebellopontine angle tumor, or midline tumor at base of skull. Meningioma, cerebellopontine angle tumor, midline tumor at base of skull. The physician incises and retracts the scalp and removes bone from the affected area. The tumor is identified and excised. The bone is replaced and stabilized. The scalp is anastomosed and sutured in layers. Craniectomy for craniosynostosis, single cranial suture. Multiple cranial sutures. Craniosynostosis is a premature closure of the sutures of the skull. The physician incises and retracts the scalp over the fused suture line. The bones are cut to reshape the skull into an anatomically correct position. The recreated suture line is left open and the scalp is reanastomosed and sutured in layers. Craniectomy or craniotomy, with excision of foreign body from brain. The physician removes a foreign body from the brain. The physician incises the scalp and cuts the bone or creates a bone flap as necessary to reach the foreign body. The object is identified and removed. Craniectomy or craniotomy, with treatment of penetrating wound of brain. The brain tissue damaged by the foreign object is debrided and irrigated. The dura is sutured closed and the bone is fastened into place. Craniectomy or craniotomy, drainage of intracranial abscess, supratentorial. Infratentorial. The physician incises the scalp and retracts it. The physician drills or cuts the cranium to access the abscess. Bone is removed. After locating the abscess, the physician evacuates it with suction and irrigates the area. The dura is sutured closed. The skull pieces are screwed together and the scalp is sutured in layers. Craniectomy or craniotomy, exploratory, supratentorial. Infratentorial, posterior fossa. The physician incises the scalp and retracts it. The physician drills or cuts the cranium to access the area to be explored. Bone is removed and the area of the brain is explored. If performing a craniotomy, the bone is replaced. The skull pieces are screwed together and the scalp is sutured in layers. Craniectomy, bone flap craniotomy, transtemporal, mastoid, for excision of cerebellopontine angle tumor. Combined with middle/posterior fossa craniotomy/craniectomy. Using a transmastoid approach, the physician incises the scalp and removes a bone flap. The tumor is identified and excised. The bone is replaced and stabilized. The scalp is anastomosed and sutured in layers. Craniectomy, trephination, bone flap craniotomy, for excision of brain tumor, supratentorial, except meningioma. For excision of meningioma, supratentorial. For excision of brain abscess, supratentorial. For excision or fenestration of cyst, supratentorial. The physician incises and retracts the scalp and removes bone over the area of the tumor, abscess, or cyst. The bone is replaced and stabilized. The scalp is anastomosed and sutured in layers. Decompression of orbit only, transcranial approach. The physician incises the frontal scalp area and retracts the scalp posteriorly and the forehead anteriorly. The frontal bone is cut and removed. The forebrain is retracted until the superior margins of the orbit are visualized. The roof of the orbit is decompressed after ensuring freedom of movement of extraocular eye muscles. The dura is closed, and the bone is replaced. The forehead and scalp are reanastomosed and sutured in layers. Excision, intra- and extracranial, benign tumor of cranial bone, e.g., fibrous dysplasia, without optic nerve decompression. With optic nerve decompression, the physician removes an intra- and extracranial bone tumor. The physician cuts and retracts the scalp overlying the affected bone. The affected bone is resected and removed. The bone is fastened into place and the scalp is reanastomosed and sutured in layers. Exploration of orbit, transcranial approach, with removal of lesion. The frontal bone is cut and removed. The forebrain is retracted until the superior margins of the orbit are visualized. The roof of the orbit is reconstructed and freedom of movement of extraocular eye muscles is ensured. The dura is closed, and the skull is replaced. The forehead and scalp are reanastomosed and sutured in layers. Implantation of brain intracavitary chemotherapy agent. A chemotherapeutic agent is implanted into a brain cavity at the time craniectomy or craniotomy is done to excise the brain tumor. Subdural implantation of strip electrodes through one or more burr or trephine hole, S, for long-term seizure monitoring. The physician implants electrodes in the subdural layer for long-term seizure monitoring. The physician uses a burr drill or trephine to reach the subdural layer and implants linear strip electrodes in each hole. Subdural electrodes are placed just below the dura and do not penetrate the cerebral tissue. The scalp is sutured to close the incisions.